Yerusalemi, iye chini ya wo mupanga. glad to be on Big God TV here in Turkey at Sarai Kumkapi. We very much welcome everyone who is watching. My name is Esther Ebiachu and I'm a medical worker. I bless the Lord that I've been given this opportunity to be here with you today. And I want to thank the administrators of this place and the producers and everyone behind this program. This program is called Obulamu, hosted by Big God TV, based here in Turkey. I greet you all, my pastors, Pastor Viola Daniels, I know you're watching, and Pastor Isaac. And thanks so much for this platform that you've given us to be able to share what we have with other people. So today we are talking about sickle cell disease. And I'm so happy to know that in this week we are actually going to celebrate the Sickle Cell Day on 19th of this very month of June. And in this week I want to encourage everyone that we make encouraging messages, write them and post them everywhere. Let's wear red, just to encourage the people that are living with sickle cell disease and those who are living with patients who have sickle cell disease. So some of you might be wondering, what is sickle cell disease? It's actually a blood disorder and it's majorly affecting the red blood cell. So in this type of disorder, you find that the red blood cell, which is normally round in a normal shape, this time in the case of sickle cell disease, it is not round. You find that it becomes hard and sticky and gives it a shape that is of letter C, making it to be called sickled. So this is how the disease comes about, and that is how you may simply define sickle cell disease: a blood disorder that affects majorly the red blood cells, in that they're not produced in the bone marrow in the normal shape, but rather produced in the C shape. So this is a disease that most people actually don't really think about. It is ignored, and yet it is really claiming so much lives in our communities. And based on the current information, actually our country, Uganda, where we're from, is one of the most affected countries because it holds the 5th position. This is so really very sad because people are not aware, since it is not like you may think of the corona pandemic. It is something that is easily ignored, and yet it is very, very important to get to know about it, because we can actually end it, because the power is in us. It is us to end it. So how do you get sickle cell? Or how does one get the sickle cell disease? Usually it involves two people, both parents giving birth to a sickler or a child with sickle cell disease. So you, in the next of my speeches, you get to hear me talk about sicklers. So when you hear the word sickler, I'm actually referring to a patient with sickle cell disease. So one parent cannot have the trait and then have the child. It involves two genes coming from both parents who are carriers or who have the sickle cell trait, and then they transfer it to their child that they produce. So when this child gets both genes from both parents, then the child will be born with sickle cell disease. So I want us to look at the signs and symptoms of sickle cell disease. Usually we will focus on the young children because they're mostly affected, and it is something that is really taking lives of young children, most especially children below the years of 2, the age of 2. Children below the age of 2 are really so much affected because some of them actually in the villages get to die before they even diagnose sickle cell. And this is just because there are very few people who know about it, and those who also know about it actually ignore it. They don't take it to be so serious. You find that even the churches out there really mind about HIV, and they never mind about sickle cell disease, and yet it is very important. I want to remind you that the power is in you. It all starts with you to break the cycle. So when you know your genotype, we break the cycle. Because when a carrier meets with a carrier, automatically we shall have a sickler. So what are the signs and symptoms of sickle cell? Basically, this child will present with frequent infections. Your child will not stop getting sick all the time. And every time you go to hospital, most cases you find that there is nothing really majorly. The findings is not malaria, it's not nothing, but they'll tell you a child has an infection. And in our last program, we talked about infection and what it means. And I know that it shall be continued with time. But as for now, we are talking about sickle cell because this week we want to encourage everyone who has ever heard of sickle cell, that person who knows sickle cell, and that one taking care of the patients with sickle cell. We want to encourage you that be strong, take courage, and then stand out and speak out. Let's create awareness so that our brethren out there do not get into the same situation. So this child will manifest with swelling of the limbs, swelling of the upper hands, the legs, most especially in the joints. And this pain varies from child to child, depending on the type and severity of the type of sickle cell disease that child has. And at this point, the pain usually comes because of those sickle shapes of the cells that are being produced by the bone marrow. Remember, they're not in the normal shape because usually if they're round in shape, they're able to move in the bloodstream so smoothly. And I want you to remember that the red blood cells carry oxygenated blood throughout the whole body. So they're very vital in your body. So when these cells are produced when they're not normal, they are in the C shape, they get through the joints and then they get to stick there. They get to log in the joints. So when they get to log in the joints, they cause the swelling and cause inflammation or the swelling. And this causes the pain and brings about the pain. And you'll also find that due to the cells that are not normal, you find that the patient or the sickler may end up suffering from anemia. And anemia is having low blood cell count in your body. Just because the cells being produced and most especially die prematurely, and sometimes the body is not so much able to produce more of them so frequently, you find that the patient ends up getting anemia. And then this patient also will find that in such children, you find out that they delay to grow. They don't grow normally like other children. Usually, when you compare a sickler and a child who is normal, they don't grow at the same rate. I want to remind you that we are talking about sickle cell, and I want to thank everyone for watching this program, and I want to encourage you to share this program because this week we are celebrating Sickle Cell Day on the 19th of June, which is this very month. And I want you to encourage every sickler, encourage people who are taking care of sicklers. I want you to wear red with me on the 19th of June, and then encourage someone out there, create awareness. So can you share this live that you're watching with your friends so they can also get to be aware? And it is through awareness that we are going to make the world know about sickle cell. So Kenny, thanks for watching. Mike, thanks for watching. Mukisa Grace, thank you for joining the program. Viola Daniels, Pastor, thank you so much for watching the program. Luiga Maria, I've also seen you on. Please, thank you so much for watching the program. And from whatever I've said, feel free to write your questions, make a comment, and please remember to share with your friends. Remember to share with your colleagues. So as we continue, I was still talking about the signs and symptoms of sickle cell. So due to this, anemia will cause a lot of things. The child will weaken, and you'll find that this breakdown of the red blood cells will cause the yellowing of the eyes, the skin, and brings about a lot of things because anemia is comprised of so many complications. But for today, I want us to first dwell about the awareness. How much are we aware of the sickle cell disease and how we get it? So I want to talk about how the child becomes a sickler. Let me go back to that first, and then I'll let you know how much it is really affecting the whole community, actually the whole world, because there are so many intermarriages going on. People are traveling everywhere. Like right now, I'm in Turkey. So it is very, very important that we get to know about this. So we have a parent. The male parent is a trait or is a carrier. So let's say the mother also is a carrier. So when these two people get married and they get produce their children, there are so many chances that they will have a sickler. They will also have they also have a chance of having a child who is normal. They also have a chance to have children who are carriers. But remember, we want to break the cycle. We are here to create awareness and then also break the cycle of sickle cell because we have the power in us. So now, we encourage, as health workers, we encourage these couples to actually consider the quality of life that they want their children to have. Just imagine having a child who is young, you produced your child, and you're not getting out of hospital every now and then just because the child is sick. And yet we have the power, because this child will have infections all the time. I told you about the frequent infections, and this child will have pain. And as any other parent, you never want to see your child have pain. So I want to encourage everyone to look at this as something very important. So for you who is not a health worker, how do you identify this child? Or how do you get to know that you are a carrier or you are sickler? Please go to hospital and then tell them you want to know your genotype. You want to know whether you have sickle cell or not. You don't need to have the medical terms to explain to them. All you need to tell them is, I want to know my status about sickle cell. Where do I fall? That is all that you need to know. So, someone was asking here, Mike was asking, is this a healthy program? Yes, this is a program held and here at Big God TV, and we usually talk about health issues. And I also want to tell you that Raising Hope International Friends are our partners in this program, and you shall be seeing some of them presenting in our programs, coming here to volunteer and make you know about sickle cell. You can also find them on Facebook, Raising Hope International Friends. They are our partners in this program. And as we continue, we were talking about the parents. How do you get to know? First of all, it starts with you, the parent. Know your genotype. Know where you stand. When you get to know that, look at your child. How do you know your child may be having those kind of symptoms that we've talked about and the signs? And also, if you have the capacity and the capability, it is still fine to go and also maybe get to check your children, because it is very much common to find that a normal parent got married to a carrier, another one who is a carrier, and these children also, they have the normal children, they have the carriers. So it is very possible these children to go on having the trait, and yet they never got to know about it. So it is very important, if you have the capability to go and make your children get to test also, please go ahead, so that they get to know their stand, so that they do not get affected. I want to encourage you once again, do not let love surpass what is coming near, in the near future, because it doesn't make any meaning for you to be in love right now and then refuse to sacrifice it just to have a child who will go through a lot of pain and never have a better life or a good quality life. So I encourage everyone, please, if you're single, count yourself lucky, because you still have the time to go and know your genotype. Please do so that we help to break the cycle. So look at your child. If you're married, you have children, you don't know what they are. Look out for the signs we talked about. That when they get sick or when they get a fever, how do they present? Do they have swellings in the joints? Which kind of pain do they express? And how do they explain the pain? When does the pain go? How frequently do they take fluids? That is very important, because you'll find that whenever these children fall sick, sometimes they may not have malaria, they may not have any serious conditions. But when you go to hospital, they'll tell you that child has a bacterial infection. And when you look at the hemoglobin levels, you will find that they'll always tell you your child's HB is somehow low. It may not be very low that he needs transfusion, but it may be a little bit low than any other normal child would always have. And this will happen so often that every time the child gets an infection, gets a small fever, he or she will present with low HB, which is something that should be worrying you. So look out for all these signs. Look at the eyes of the child. Are they yellow? Look at the skin. Is it yellow? Look at the way they respond to the infection. Because ideally, some of these children, when they come in and they say they have a bacterial infection, they actually don't need the antibacterial drugs. You may find that you may give them fluids with painkillers and they get well. So you need to be curious about your children and how they present, because this is something that is so serious, to the extent that, according to the current information, as Uganda, we hold the 5th position, because yearly we have around 30,000 children that are being born with sickle cell disease. And these children, usually, many of them die below the age of 2 years. So imagine the pain that you go through after giving birth to your child, and then you lose that child before even he or she makes 2 years. as a parent, this is something that is so traumatizing and that is so painful to bear. So it is better you hold it right now, you stop it right now, before you continue and make any other progress as far as relationships are concerned. In some countries like Nigeria, because Nigeria is holding the first position of the cases that are born yearly of the sicklers, DRC is the second, Zambia third, Tanzania the fourth, and then Uganda the fifth. There are so many other countries suffering with sickle cell, especially those states that are having a lot of migrants in them. And you may even also try to look at the statistics in the US. They are also having quite a number of cases that are being born yearly, and they are sicklers. So I want us to consider this as something very important, because it is so sad to lose so many kids, or to have so many people, so many children being born when they are sicklers. So everyone, you have the power. Remember, this week we are celebrating the Sickle Cell Week, the Sickle Cell Day on the 19th of June. And I want you to encourage everyone who has a patient who is a sickler. I want to encourage everyone who is a sickler that you are not alone. You are a warrior. You are stronger than ever. And you are a fighter. We never give up. That is my message to you. And because of you, that is why we are here today. We are here to help stop the cycle of the sickle cell disease, because this is something that is inherited. It is genetical. It is not like corona that you may find it to another person who is passing by you. This is something genetical. So it is our choices that are going to matter in this case. I want to encourage you, please take the choice. Take the choice, take the lead of not taking on the cycle. Choose to break the cycle. Choose to know your genotype. And I also want to remind you that Rising Hope International Friends is specifically having a platform for you to ask any question about sickle cell disease. They are our partners in this program, and we shall be learning a lot of things, many other conditions apart from sickle cell disease through them, because they are health workers too. We have so many counselors that are working with us, and you will benefit with us. So as we continue with the program, we are going in a short break, but I also want to remind you that in case you want a trusted online business person you can work with, you want to wear like I'm wearing, Beautiful Exchange is waiting for you. The contacts shall be given to you on your screen, but you can always search for someone you can trust. You want to import something or export something wherever you are. We are based here in Turkey, Beautiful Exchange. We are based here in Turkey, and we shall deliver to you whatever you need, whether you need clothes or anything. They are our sponsors for this program. So you will get the contacts and get in touch with them. Ask for whatever you want, and you will get it right where you are. Thank you so much. We'll go for a short break and we'll get back to you.
Era yakugamba golokoka yaka ezibadde ensozi zonna zimaze okusanuka tunula wetegereze omukanga azikiridde obusale bwe bufuuse omuyonga kawejungira ase nga yebagadde kuba kerubi mukama akuviriddeyo n'ekitiibwa kye kakirabikire kugwe leero golokoka yaka golokoka yaka golokoka yaka golokoka yaka golokoka yaka golokoka yaka okumasamasako tunulawo magemage akunganyiza banjijoli bawala bo ne batabani bo balengere bazze n'ebirabo bingi obusukirivu obw'okunyanja n'obugagga bw'amawanga bakuleetedde golokoka yaka golokoka yaka golokoka yaka golokoka yaka golokoka yaka golokoka yaka kwatibwa ekisa kingi ezigizo tezigalwenga w'emisana n'ekiro oyingiza obugagga bw'amawanga banaggwanga balizimba enkomera zo bakabaka bali kuweereza golokoka yaka golokoka yaka mukama kwise golokoka yaka kulela kusimye golokoka yaka akutakemu ekitiibwa golokoka yaka ogenda omujulire golokoka yaka obadde mwesigwa mu bitono golokoka yaka akukwasa bingi golokoka yaka akutumye mawanga golokoka yaka otwala omusana golokoka yaka n'abaana babagambye golokoka yaka nti yali basomesa golokoka yaka emirembe gyabwe ku nsi golokoka yaka agambye ekiriba n'ekibambi golokoka yaka ngero kigwe mageranga golokoka yaka lela mukomya golokoka yaka ntegolesebwa kubula golokoka yaka kakuzibula maaso golokoka yaka otubule olabe golokoka yaka emisikulinze golokoka yaka
Thank you again for watching. You're very welcome. And you are watching Big God TV, based here in Turkey, Aksaray, here at Kumkapi. You're very welcome and thank you so much for joining us. We are back again, and I want to remind you, if you've just joined, you are here to talk about with me sickle cell disease, and that is our topic for today. The program is Obulamu, and we talk about health issues here. So we are going to talk about the cells once again. As you can see on your screen, the pictures that are presented, the normal red blood cell is round in shape. The normal red blood cell is round in shape. And then, if someone has the sickle cell disease, the bone marrow produces the sickled red blood cells, and those are usually C by shape, just like it is shown in your screen. So, when the body produces normal red blood cells, they move smoothly and they never log anywhere, regardless of the joint. But as you can see in the picture, when the sickled blood cells move in the bloodstream, When they reach the joint, they block or clog into that joint, and then they get to pile up, causing inflammation and so causing the pain. So in the lower picture below, you'll see that the movement of the normal red blood cells is so smooth and they never lock anywhere, even if it is the joint. But if the person is a carrier, it means you have the normal red blood cells, and then also you have the sickle blood cells too. So some carriers present with symptoms and some do not have any symptoms, depending on each and every person. You'll find that some of the carriers could be having a lot of sickle cells, and they may also present with some signs and symptoms of sickle cells. But some of them may not present with any symptom, and that is the most dangerous part of it, because most of the carriers do not present with anything. They don't show any sign, they don't show any symptom, they are always normal. So we will see that in the picture that is on your screen right now, the parents are both carriers. So the carriers will produce kids. They have a chance of having a child with sickle cell, a child with a sickler, and then they will have two chances of producing carriers, and they will also have a chance of having a child who is normal. But I want you to remember that these are chances. It is not a guarantee. And it doesn't mean that when you produce the first child when it's a sickler, it doesn't mean that the second it will automatically be normal. And it doesn't mean that the third will automatically be a carrier. It does not have any criteria, because you may even not start with a sickler, and yet both parents are carriers. So let's not take it for granted. Let us just keep keen and get to know our genotype. Sister Bibi, thank you for watching. Nasuna, Penina, thank you so much for watching. Mbogo Sandra, thank you for watching. And Skizzy was saying, it is everyone's responsibility to create awareness, psychoeducation, and refer those who present with the signs and symptoms to the health center. We will break the cycle. Thank you so much, Mike, for watching, and thank you for the great message. Benon Bless Washington, thank you for watching, and thank you for sharing. Konya Sanon, thank you so much for watching, and thank you for joining our program. Thank you, everyone. Mirembe Grace, thank you so very much, and thanks for always sharing the program. So, why are we so much concerned with sickle cell? And why sickle cell in this week? For the week, it is the sickle cell week, and we are celebrating it for them. We want to encourage them. We want to help break the cycle. We want to stand with them and then break the cycle, because they are warriors, they are strong, they are fighters, and they never give up. So we want to stand with them and help break the cycle of sickle cell. So, why are we so much concerned with sickle cell disease? First of all, it has claimed a lot of lives of our young children, because most of them usually die before the age of 2, and so causing a lot of pain and stigma to the parents and to everyone around them, because some of them actually never get to find out why the child got to die, because they never knew their genotype. There are so many kids that died because maybe they can't afford health facilities, and so they get to die before the parents even get to know why the kids are dying. And then also some people are not really so much aware. Depending on where you are, there is very little awareness of sickle cell, and that is why we are here, to create awareness to everyone, to let you know about sickle cell. Please mind about sickle cell while you are relating with anyone. Let it be just like you may check for HIV. Check your genotype too. Before you get into a relationship, before you go any further, please find out the kind of children you're going to have, which quality of life will they have, because it will not make any sense for you to have so much pain for your child, suffering with that pain for the rest of their life, and yet you can help break the cycle before it even starts. Well, I'm not saying there is no cure for sickle cell, only that it is very expensive and very costly, and that is the bone marrow transplant, which at most cases, some parents, not every parent matches their children, even if they are the real parents. It is not a guarantee that you'll match to be a donor of the bone marrow for your child. So prevention is better than cure. So how much affecting is this to the families? First of all, it is very hard to tell someone, I understand the pain, because nobody understands the pains of losing a child. It depends on everyone, and different people handle pain differently. So please take this to be serious in everything that you do. If you're a counselor, please let people know about sickle cell. If you are a marriage counselor specifically for marriage, please let people get to know their genotype before they even continue to make their vows to each other, because this is something affecting everyone and causing stigma to so many families and communities. And you will find that some marriages are broken because of sickle cell. They never get to understand each other, and they end up blaming themselves. They end up blaming each other for the death of the child. And yet we understood earlier on that this is a gene gotten from both parents for a child to be a sickler. So depending on the type of the disease, the sickle cell disease the child has, it really affects so much, especially the children below the age of 2. I'm not saying they do not grow. They grow up. We've seen so many sicklers who have grown up. They're even above 40 years, some of them 60 years. But those are the lucky ones. And it depends on how much aware the parents were, because some of these children actually have been lucky that their parents have gone to the health facilities and they have gotten to know their conditions and they have been so supportive. But to some families, you find that some of them are running away. One of the parents is gone just because the child is a sickler, leaving one parent to struggle alone. But I want to encourage you, please, the power is in us. Let us be aware of sickle cell disease. Save it day, Yasmin. Thank you so much for watching, and thanks for joining. Do not forget to share. And as we continue, when these kids get this condition, there are so many things that come about with their conditions. You find that the child would end up having retinopathy. Basically, in this condition, the child's eyes are affected. And you'll find that due to the mental retardation, this child will also suffer stigma in the community, because I told you earlier on, it also affects the growth of the child. And when we also look specifically at anemia, anemia has so many complications that you cannot count. It comes about with so much. You'll find that this anemia will affect most of the organs in the body of a sickler, regardless of the age. You'll find that there will be cerebral infarction with that person, which may also lead to stroke in some patients. And you'll find that this very patient who is a sickler will also suffer with splenomegaly. And there are so many things that you'll find with a patient who is a sickler. And the patients also may end up having the bone marrow hyperplasia, and this is also something that is so big and so huge for that for the sickler to handle. I want to thank you all for watching the program. Mike says, let's as well try our best to help the caretakers of sicklers with psychosocial support, and with psychosocial support, because at times they suffer the most. That is very important. Like I said earlier on, as a parent, when the child suffers the pain, you suffer the most. You feel the pain more than they do feel the pain. And you'll find that if a child has tried to grow, you find that the child is instead encouraging you, trying to give you the strength. And yet it is not so easy. So everyone around a patient who is a sickler and around that person who is taking care of the sickler, please be as supportive as possible. Make sure they are supported. Do not stigmatize them. Do not abuse them. Sickle cell is not an abuse. It is not like something that can just be gotten someone when they have looked for it. This is something inherited. It is genetical. So nobody knows how or when they get it. Nobody looks for it. Only that you find yourself when you're being born and you are a sickler. So please, let's just encourage everyone who is a sickler. And I welcome you all. In case you have any questions about sickle cell, don't forget to ask your question. Kunya Sanon said, I might be the one affected, yet I need to choose a partner. Which advice do you give me? Okay, thank you so much, Sanon, for watching. This is a very good question, especially for you as someone who is single. So as I said earlier on, know your genotype. It starts with you. Let it first start with you. Do not wait for your partner. This is not HIV. It starts with you. So know your genotype, go to the health facility. Tell them, I want to know my genotype. If you forget the word genotype, tell them, I want to know about sickle cell, my status about sickle cell. Just like you may talk about your status of HIV, just tell them, I want to know my status about sickle cell. They'll know what to do. The health workers will know what to do, and they will help you to find out what your genotype is. And so after knowing your genotype, that is when you go ahead, speak or share it with your partner, and then let them know about sickle cell, and then tell them the advantages of knowing your genotype before you even get married. I want to let you know that the numbers on our screen, you can ask any questions that you want. You can call us or WhatsApp us with a message, anything about sickle cell, we shall always answer. And remember, Raising Hope International Friends is partnering with us, and you can find us on Facebook. You can always send a message and you will be answered right away. Anything you want to know about sickle cell disease, they will answer it. And how you get started with knowing the genotype, you will get started. And if you are in Kampala and around Kampala, you can reach out to Raising Hope International Friends offices. You will find them. You can just type them a message and they'll give you the directions, and they will also go ahead and help you get started on how you can get to know your genotype. Thank you so much for watching. Thank you for the questions, and I continue welcoming you with every question that you have. If I get to see that the questions are being so many, we can answer these questions on the next program that will be on Thursday at the same time. So feel free to ask your questions, send in your questions, they will be answered immediately. And if you feel they are so confidential, and you don't need to publicly say them out, please check on your screen and you'll send a message on the WhatsApp number that you're seeing. If you were in Turkey, or if you can access a call, if you can afford a call on that number on your screen, please make a call. You will be answered for any question that you have. So please take note, as us who are listening and as you who is watching, what you have learned, you do not keep to yourself. Please share the knowledge with your friends. Encourage everyone to get to know their genotypes. Go ahead, spread the news. The power is in your hands. Remember, on 19th of June, this very month, we are wearing red. I want to see you wear red for the sicklers, for those who are having sicklers, for those taking care of sicklers, for those who are actually encouraging and helping out the sicklers. We are fighting sickle cell, and we have to stop the cycle, to help break the cycle. And we can do this because the power is in our hands. So remember, you're watching Big God TV. We are based here in Turkey, Aksaray, Kumkapi, and we are sponsored by Beautiful Exchange for Obulamu program. You can reach out for any business, online business that you can trust. Beautiful Exchange, find us on Facebook. And the major sponsors of this program is Big God TV for Big God Church here in Turkey, Aksaray, Kumkapi. So thank you so much everyone for watching. Remember, every question is still welcome. My name is Esther Ebiachu, and thanks for joining this program.